Hi, this is Meenakshi Jolly, and we are going to talk about a very important topic today for lupus patients, which is fatigue or tiredness. I have not met a single lupus patient that did not complain about tiredness. Truthfully, probably I have met some, but most every patient has experienced tiredness at some point of time during their disease. A great majority of patients with lupus complain of excessive tiredness that becomes one of a major problem for them and affects how they carry their day-to-day life or anything that do or are not able to do. So it has a significant impact on people's lives, and people look for a solution for fixing this fatigue so that they can start to live their life again. So what do we know about fatigue in lupus? In lupus patients, there can be several reasons why they may have fatigue. First of all, if they have an active disease, that can make them fatigued because their body is trying to fight the cells of their own body, and this process takes up energy, and the protein level in the body may be down and it may cause fatigue. If the fight is against your red blood cells, then can cause anemia and give you fatigue. If it is affecting your kidneys, fighting your kidneys, that may give you fatigue. Any organ that it is affecting, essentially, if your disease is active, can be a very common reason for fatigue. So getting your disease under control is very, very important. Apart from that, patients with lupus may have fibromyalgia. Up to 1/3 of patients with lupus may have this disease called fibromyalgia, where they hurt all over the body, literally, and have difficulty sleeping, are tired all day long, and in pain all over. If you have fibromyalgia, getting attention for that, getting the right diagnosis, treatment may help with that fatigue. In addition, remember this: when you have one autoimmune disease like lupus, you are at a higher risk of developing another autoimmune disease. One of the common autoimmune disease that patients with lupus frequently have is thyroid problems. Generally, people don't think of that as an autoimmune problem, but it can be autoimmune. And low functioning thyroid or hypothyroidism can be a very common cause of tiredness in patients with lupus. So getting that diagnosed or knowing if that is the reason may help with the fatigue by getting the appropriate treatment for that. Depression, because of the disease itself, as a part of lupus affecting your brain or your emotions, can also be associated with tiredness. Depression may also happen because you have been diagnosed with a disease that may be lifelong and you're young, when an age when you don't expect to be sick, or knowing that you have to deal with this for lifelong and not know when this may flare, or that you need to see doctors all lifelong. Coping with it, a new diagnosis, may also add to depression and affect your energy levels. Sleep affected from any reason can cause fatigue also. So sleep hygiene is very, very important. Not taking naps during the day, exercising, relaxing, maybe a warm bath may help. Whatever helps you relax. Meditation, tai chi, music might help. Sometimes dancing may help because it may tire you as well as relax you, and then you may be able to sleep. Avoiding caffeine products or watching very exciting TV or such when you are wanting to go to sleep may not be helpful for your sleep. Apart from all those reasons, there can be numerous other things, stresses in your life, or the support system that you have available may be some of the reasons. In addition, smoking can be associated with fatigue. Lack of exercise could be associated with fatigue. discuss this with your doctor, your primary care doctor, as well as your rheumatologist, and see which of these things may be causing your tiredness and get attention for that. Especially if you have depression, pain, or sleeping problems, do get attention for those. There are cognitive behavioral therapies from psychologists that can help you cope with the disease. Getting support, talking to other people may help, other friends or your partner or your family, that may help. Talking to other people who have lupus may help. Learning from their experiences, how they have dealt with the disease or with their tiredness, or how they've come around it, may be useful to learn strategies to deal with your problems. That may also be helpful. One thing that may actually help you is doing some sort of exercise that can be done routinely for you, maybe 3 to 4 times in a week, at least for 20 to 30 minutes every time. Would be helpful. I would not suggest going for any extreme exercises, exertional exercises. Maybe it's just gentle stretching, mild basic yoga, basic Pilates, or water exercises would be really good. Water exercises are especially very good for patients with pain, fatigue, as well as other diseases, because here you're not exerting your joints or muscles against gravity, and the water itself is very soothing being around. And if the water is warm, it is again very soothing. And sometimes it's useful to do these water exercises as a group with other people, so that gives you energy to do it, as well as see other people's process of how they deal with these things and do exercises, but also gather support from them and continue to do the exercises. It's also a good way to socialize and find friends and make friends with similar things. Those are some of the strategies that may help you with fatigue. To address your pain, if you are in pain, that is also very important. In summary, I'm telling you there are numerous things that can cause fatigue in patients with lupus. It does need to be teased out. Some medications may also be adding to fatigue. So do discuss this with your doctors, your primary care doctors, as well as your rheumatologist. Go over the list of medications, go over pain, sleep issues, depression issues, and such, and see what could help you.